Good day guys, we have been discussing about the arterial supply of the lower limb in the earlier videos. Now we'll discuss about the venous drainage of the lower limb. There are three types of veins that drains the blood from the lower limb. They are the superficial veins, the deep veins, and you have the perforating veins. So what are the superficial veins that drains blood from the lower limb? So they are the great saphenous vein, and you have the small saphenous veins. The deep veins have the same name as arteries. So we have femoral artery, and so we have femoral vein. You have popliteal vein. You have anterior and posterior tibial veins. Same way as you have the peroneal vein, also known as the fibular vein, and you have the lateral and medial plantar veins, and you have the dorsal and pedis veins. But the main veins are the femoral vein, popliteal vein, anterior and posterior tibial vein. And you have the perforating veins. So the perforating veins are Anterior veins and the proximal thigh. And you have voids vein and distal thigh. And you have doids perforating vein below knee. And finally you have cockets perforating veins in the posterior arch vein. This posterior arch vein is the branch of great saphenous vein. So we have superficial veins, which are the great saphenous vein and small saphenous vein. We have the deep veins, which are the femoral vein, popliteal vein, anterior and tibial veins, anterior and posterior tibial veins. And you have the perforating veins, which are the anterior vein and the proximal thigh, voids vein and the distal thigh, and you have doids vein below the knee, and you have cockets vein. There are around 3 cockets vein, upper, middle and lower, and the posterior arch vein. So now we'll discuss about the great saphenous vein, small saphenous vein and its branches. So here you have the deep veins. As I told you already, the deep veins are the femoral vein, and you have popliteal vein. So you have the femoral vein, you have the popliteal vein, you have the anterior tibial, posterior tibial vein, and you have the branch of posterior tibial vein, which is the fibula or the peroneal vein. So this is the femoral vein, and this is the popliteal vein, and this is the anterior tibial, and this is the posterior tibial vein, and you have peroneal vein. Now we'll discuss about the branches of the great saphenous and the small saphenous vein. And as you know, the veins from the digits, actually the veins from the digits, it drains into the dorsal venous arch. You have the dorsal venous arch on the foot, so you have the veins from the digits which drains into the dorsal venous arch. So this is the dorsal venous arch. You also have some veins called as the medial marginal vein as well as the lateral marginal vein. So this is medial marginal vein, and you have the lateral marginal vein. So the great saphenous vein actually starts with the communication of dorsal venous arch as well as the medial marginal vein. So we will study about the great saphenous and small saphenous. So the origin of the great saphenous is the communication of dorsal venous arch as well as the medial marginal vein. So it starts from the medial marginal vein and dorsal venous arch. And the small saphenous vein starts from the communication of dorsal venous arch as well as the lateral marginal vein. So here it starts from the medial end of dorsal venous arch, and here the small saphenous vein starts from the lateral end of dorsal venous arch and lateral marginal vein. So here it's the communication of lateral marginal vein and the lateral end of dorsal venous arch, and here in the great saphenous vein it's the medial end of dorsal venous arch. So the great saphenous vein ascends and when it reaches the posterior side of the knee joint, it runs posteriorly, and when it reaches the posterior end of the thigh, the posterior aspect of the thigh, again it runs anteriorly. But when it reaches the middle of the thigh, the medial aspect of the thigh, when it reaches the medial aspect of the thigh, it runs again anteriorly, the front part of the leg, the front region of the leg, and it opens into the saphenous opening, the great saphenous opening, and it drains into the femoral vein. So where does the great saphenous vein drain into? The great saphenous vein drains into the femoral vein. When it reaches the great saphenous opening. And now we'll speak about the branches of the great saphenous vein. So the foot, as you know already, as I told you already, it starts from the communication of medial marginal vein as well as the medial end of the dorsal venous arch. So the first branch of the great saphenous vein in the foot is going to be the medial marginal vein. So the first branch is medial marginal vein. And then when it reaches the leg, you have the posterior arch vein. When it reaches the leg, you have the posterior arch vein. This is the posterior arch vein. And then when it reaches just below the knee, you have anterior saphenous veins. And just below the knee you have anterior veins. These are the anterior veins below the knee. And when it reaches the thigh, you have the accessory saphenous vein. So when it reaches the thigh, you have the accessory saphenous vein. So these are the anterior veins, and here you have the accessory saphenous vein. So at the foot you have the medial marginal vein. When it reaches the leg, you have the posterior arch vein. Below the knee, you have the anterior veins, and you have the accessory saphenous vein when it reaches the thigh. And also, when it drains, to the femoral vein. The great saphenous vein gives out 3 branches just before it drains into the femoral vein. These are the superficial circumflex iliac vein, the superficial epigastric vein, and you have the superficial external pudendal vein. Just before it drains into the femoral vein, it gives out 3 more branches, which are the superficial circumflex iliac vein, superficial epigastric vein, and you have the superficial external pudendal vein. These are the branches of femoral vein. So now we will have a quick summary about the great saphenous vein and its branches. So a great saphenous vein, the origin of great saphenous vein is from the medial end of the dorsal venous arch as well as the medial marginal vein. It starts as the communication of dorsal venous arch as well as medial marginal vein. So the great saphenous vein drains into the femoral vein when it enters the great saphenous opening, the cribriform fossa. And you have speaking about the branches of the great saphenous vein. The first branch is the medial marginal vein, and the second branch is the posterior arch vein, and you have the anterior veins below the knee. And when it reaches the thigh, you have a branch called as the accessory saphenous veins, and you have this just before it drains into the femoral artery, you have 3 branches, which is the superficial circumflex iliac vein, you have the superficial epigastric vein, and you have the superficial external pudendal vein. Now coming to the small saphenous vein, the small saphenous vein actually runs to posterior side of the leg. So the great saphenous vein, I forgot to add one more point, the great saphenous vein, it actually runs in front of medial malleolus. That means it runs the anterior side of the leg, and the small saphenous vein runs behind the lateral malleolus, which means it runs to the posterior side of the body. It runs behind. So it runs behind the posterior side. It runs at the posterior side. So when it reaches speaking about the small saphenous vein, the small saphenous vein actually runs to the posterior side of the body, and it drains into the popliteal vein. So it drains into the popliteal vein. So this is the small saphenous vein. So the small saphenous vein, it drains into the popliteal vein. And speaking about the branches of the small saphenous vein, it gives out numerous small branches. There are no much branches of the small saphenous vein. It just gives out numerous small branches, and it drains into the popliteal vein. And there are 2 important communications of the small saphenous vein. The first communication is, so let's consider this as the posterior side of the leg. So let's consider this as the posterior side of the leg. So the great saphenous vein runs behind, and so as I told you already, so when the small saphenous vein reaches the popliteal fossa, and here you have the popliteal vein, and then when the small saphenous vein reaches the popliteal fossa, it drains into the popliteal vein. And as I told you, when the great saphenous vein reaches the knee joint, it runs posteriorly. So the great saphenous vein actually runs anteriorly, and when it reaches the knee joint, it runs posteriorly like this, and again it runs anteriorly when it reaches the medial aspect of the thigh. So the popliteal vein transversely communicates when it reaches the popliteal fossa. It transversely communicates with the great saphenous vein. That is one of the communications. The first communication is it transversely communicates with great saphenous vein. And you have a second communication. That communication is called as the Giacobini vein. So the Giacobini vein runs from the upper part of small saphenous vein and it runs medially to reach the upper part of great saphenous vein. So it starts from the upper part of the small saphenous vein and it runs medially to reach the upper part of great saphenous vein. So, and also this Giacobini vein is also called as the cranial extension of the small saphenous vein. So it also called as the cranial extension of small saphenous vein. So as I told you already, the great saphenous vein runs in front of medial malleolus, and so the small saphenous vein runs behind the lateral malleolus. And also you have the perforating veins, which I told you already. So you have one perforating vein in the thigh connecting with the great saphenous vein from the side of adductor canal, and you have one below the knee joint, and you have this Cockett's perforating vein, and you have one perforating vein connecting with the peroneal vein. I hope you guys understood about the venous drainage of the lower limb. Thank you so much for your time. I'll keep you posted on the next videos. Thank you so much.